morning wake-up call with Holloway in London. The wake-up call on 1120 KPNW.
So a lot of people are quitting smoking, and one of the big things now, and it's weird how celebrities in this country sort of drive the culture and the talking points. And in a lot of ways, it's rather silly that they do. But one of the things right now is that they're saying, oh, hypnotherapy. It's the thing. I guess Ellen DeGeneres, Drew Barrymore, Ben Affleck, Matt Damon, they've all used hypnotherapy to quit smoking. So this morning, to talk a little bit about quitting smoking and some of the easiest ways to do it and whether hypnotherapy really is worth it, is Dr. James Pinkney, or we'll just call him Dr. James, joining us on the wake-up call. Dr. James, thanks for being here.
Oh, thanks for having me on the show.
Yeah. So in reality, I mean, from the research that you've done, in reality, how effective is hypnotherapy to aid in smoking cessation?
Hypnotherapy actually does work in helping smokers quit, but we need a little bit more evidence to determine if this intervention is better than the traditional pharmacotherapies that I use, such as Chantix or Nicorette gum, combined with behavioral therapies.
How do you go about testing something like that? I mean, to see if it works. I mean, particularly when you're basing it on something that's kind of hard to pin down, like addiction.
Well, yeah, the way we test anything is with clinical trials. So the best way to test hypnotherapy is through a randomized, controlled study. But unfortunately, we don't have those type of studies to really pinpoint, is hypnotherapy better than, let's say, nicotine replacement or e-cigarettes?
So, well, let's talk a little bit about e-cigarettes for a second, because, we hear this ongoing debate, and generally it's done by the different attorney generals of states looking for money, and that is that, oh, well, e-cigarettes, they don't work. They don't work as an aid to quit smoking. It sounds to me like you think they do.
Yes, I've read some studies in the American Journal of Medicine that do show that e-cigarettes are effective, but again, we don't have the data to say that e-cigarettes are more effective than behavioral counseling or medications.
Okay, so let's talk a little bit about the medications. Aren't they essentially antidepressants?
There's one, bupropion or Wellbutrin, that is an antidepressant, but the one that I use first line is Chantix, and that's a partial nicotine agonist. So what I do with my patients at Diamond Physicians is I'll start them off Chantix 1 week before their quit date, and then I'll combine that with a nicotine replacement drug, such as a nicotine patch or nicotine gum. And when you do that and combine that with behavioral counseling, you really have the most effective means for smoking cessation.
Okay, so what you're doing is you're combining a number of things. You're combining the, like the Nicorette, the drug, and also the counseling. It sounds to me like there's no just one surefire thing, as opposed to combining a whole bunch of different things, at least in your experience.
Right, and that's because there's two major barriers to quitting smoking. So the first one is the largest barrier, and that's the addictive nature of nicotine. So nicotine is a very potent psychoactive drug, and it actually causes physical dependence. So when people stop smoking, they go into nicotine withdrawal, and there are real symptoms associated with nicotine withdrawal. You get depressed, you can't sleep, you're irritable, you're angry, you're frustrated. You can have increased weight gain because you have increased appetite. So that's why people go back to smoking, because those symptoms are alleviated. The second barrier is the association of smoking with environmental triggers.
Yeah, you go to a bar and you start throwing back some beers, you want a cigarette, or that first cigarette with a cup of coffee in the morning.
That's exactly right. So hypnotherapy works to break down those barriers. It helps you stop smoking with the things like the morning cup of coffee or an alcoholic beverage.
All right, well, how important is just, and I'll tell you why, my question here is what it's based on, how important is mindset? Because I had tried, and I'm a former smoker, and I had tried a number of times to quit smoking, and I finally had, this kind of epiphany, and from that, I quit cold turkey and haven't had a cigarette since, and it wasn't all that difficult to get around it. How much does mindset have to do with it?
Our mindset plays a huge role. The smoker has to be willing to quit. It might be one of the most important things. You have to be in the proper mindset to really take advantage of all the therapies out there that we have to offer.
So, is there any expectation that we're going to see some more research done on hypnotherapy and how effective it is?
As therapies become more mainstream, then it kind of piques the interest for researchers and PhDs and medical doctors out there. So hopefully soon we will have some randomized controlled studies that will really assess hypnotherapy and give us some evidence that we can say, you know, that hypnotherapy is better than our current pharmacotherapies, because medications have side effects. And in hypnotherapy, there's no side effects. So I'm always going to look at things that don't use medicines if I can.
Well, briefly, I mean, the Chantix, for example, that you've mentioned a number of times, what are the side effects of that?
The biggest side effect and the biggest black box warning for that is going to be depression and suicidal ideation, suicidal thoughts. So
well, that makes it worth quit smoking.
So, like I said, with every medication, there's a laundry list of side effects. But, you know, we have to weigh the risks and the benefits of putting a patient on a medication.
So how soon do
Smoking is the leading preventable cause of death in the U.S., and 1 out of 5 deaths in America can be attributed to smoking. So it's a huge risk, smoking, and therefore the risk of putting someone on a medication outweighs the risk of continuing to smoke.
Dr. James, we appreciate you joining us on the Wake Up Call this morning.
Oh, you're very welcome. Thanks for having me on.
All right, you take care. Dr. James Pinkney on the Wake Up Call this morning.